Good morning, everyone. This morning we are going to share some information about our IMLS grant, Advancing Digital Equity in Rural Agricultural Communities, an applied research project with farm workers, community health workers, growers and producers, and public libraries. I'm Mary Roby, Assistant Director for User Services at Lapis Health Sciences Library at East Carolina University in Greenville, North Carolina. My colleague, Jamie Bloss, and I are going to walk you through the three aims of the grant and the key takeaways from our research. As you can see from this slide, many faculty and researchers from ECU and NC State University were contributing partners on this grant. This is a broad overview of our project, a library-centered applied research program to advance digital equity for farm workers in North Carolina. We were awarded $750,000 over a 3-year period, August 1st, 2022 through July 31st, 2025. It includes 2 UNC system schools, as I said, ECU and NC State. The broad goals of this program are addressing digital inclusion, to engage civically, improve health, education, economic status with broadband access for farm workers and their communities, and to document information to support policy change. This project includes 8 research questions divided among 3 project aims. Our research will attempt to answer 3 main questions. These questions correspond to the 3 aims. How accessible is internet for farm workers? What are the information literacy levels of farm workers and farmers? How well are farm worker communities being served by information facilitating organizations like libraries and internet service providers? The main project in the AIM 1 part of the grant was a survey given to farm workers. We created what we believe, based on our research, is the largest survey administered to farm workers in North Carolina, assessing internet access, devices used, and cost of internet. 20 community health workers, or CHWs, across 8 sites administered the survey to 1,034 farm workers across North Carolina during the 2023 agricultural growing season, May 31st, 2023, through December 27th, 2023. We thought that this audience might be particularly interested in the development of the survey instrument. We began by researching existing similar surveys and by doing a lit review. Then we created a code book that included all possible questions for the survey and included the citations showing where we found that question. We met with our advisory panel to solicit feedback on the survey question. Our advisory panel includes representatives from our state partners, NNLM, and other relevant organizations. We attended several CHW-related training meetings and conferences to brainstorm ideas about survey questions, solicit feedback, and provide more detailed information about the grant. We finalized a draft of the survey, and Emery Harwell, our NC State bilingual research assistant, pilot tested the survey with 5 people. The offline Qualtrics survey was loaded onto iPads in both Spanish and English, then given to the 20 CHWs who verbally administered the survey to the farm workers at their sites. Unsurprisingly, the majority of respondents were male, of Hispanic Latino ethnicity, born in Mexico, and spoke Spanish. Most farm workers reported having internet access of some kind. They predominantly access the internet through cellular data, have a cellular phone with internet, and have a device with video capabilities, and they pay for the internet on their own. Farm workers spend on average $43.60 per month on internet service. 81% of the participants had consistent cell phone coverage for calls or texting, but over 13% could only send messages some of the time. Mobile phones were by far the most common devices used by farm workers. A few years ago, the NC Farm Worker Health Program distributed emergency hotspots that greatly improved internet access for many farm workers. Of those who had internet access as a result of receiving those hotspots, 21% reported having internet access sometimes, and none reported no internet access. Of those who did not receive state-supported hotspots, 25% had internet access sometimes, and 4.3% had no internet access. There is still a significant percentage of farm workers who reported that they did not have fast enough internet to watch an online video. 80% of participants use cellular networks. The most commonly used social media platforms were WhatsApp, Facebook, and YouTube. Almost 1 in 4 farm workers did not have consistent internet access. The Affordable Connectivity Program, which ended in April, and the state hotspot program are limited by funding, and thus are unlikely to be permanent solutions. Slightly more than half of farm workers did not have internet speeds that allowed for consistent use of video calls. The majority of farm workers are using cellular data and mobile devices for their internet access. Our findings document important inequities in access to the internet and the services and information therein for farm workers. We have completed the survey collection portion of AIM 1, and we are continuing to analyze the data and are disseminating the results through various conference presentations and journal articles. Now I'll turn it over to Jamie, who will share AIMs 2 and 3.
So I'm Jamie Bloss. I am a research librarian and library associate professor at East Carolina University in Greenville, North Carolina. And I'm going to start sharing about AIM 2. So our main research question for AIM 2 was, what are the information literacy levels of farm workers and farmers? To that end, we decided to do a mixed methods approach. We started with focus groups and interviews with growers and farm workers, and then are developing a survey for both farmers and farm workers in year 2 of the grant. The main findings from the qualitative portion of AIM 2 reflect what is generally indicated in the literature, that age and education levels can somewhat determine the digital literacy skills of farmers. Farm workers seemed less confident in their digital and information literacy skills overall, but they also lack the time and opportunity to learn more. Some quotes from the qualitative portion of the study read, and this is from a farmer in Sampson County, North Carolina: "The older you get, the more of a challenge that is. Even if you get trained up, the technology is always evolving." And a farm worker that we interviewed said, "Like we were saying, I lack literacy and I would like to learn the internet because it's nice. Like years ago, phones weren't a thing, so we would line up to talk. And now the internet is really nice. But for those who learn it, for those who have studied it. But for me now, since my time has passed, I didn't learn it. But I do like the internet, except when the network falls. But aside from that, everything's fine. I do like it. It's a shame that I'm old. If I wasn't, I would like to learn much more because it's really nice." So from the survey we developed, asking questions about digital and information literacy skills, we do have some preliminary results from the survey of the farmers. 129 people responded, and most had access to a digital device. Almost half had made and attended a telehealth appointment, and about half had never done so, highlighting the divide in comfort levels and access to these types of appointments for rural constituents. 54% of respondents were willing to do a telehealth appointment, but a good portion still did not prefer doing a telehealth visit. And now moving on to AIM 3 of the grant, the primary research question was, how well are farm worker communities being served by information facilitating organizations like libraries and internet service providers? We surveyed public libraries and some academic and community college libraries to find out more. We had 58 responses total, and 50% of those had already participated in some form of outreach to agricultural communities. Since the outreach to farm workers specifically was so low, we reported out on the biggest barriers in North Carolina were a lack of time, lack of knowledge about how best to work with the farm worker community, and 67% who were not interested in outreach at all just said it wasn't a priority of their administrators. We also asked if libraries had participated in broadband planning or implementation. 30% of the libraries that responded had participated in some activities related to this. As a second part to AIM 3 in our second year of the grant, we're now conducting interviews with librarians and administrators who had participated in either outreach to agricultural communities or broadband planning. We would like to give some more info about our project and the contact information of the two presenters today, and you can see our emails on the screen. We'd like to give a huge thank you to Student Action with Farm Workers, the community health workers who worked with us in AIM 1 and 2 of the grant from Ashe County Cooperative Extension, Contentnia Health, El Proyecto or the NC Farm Workers Project, Good Samaritan Clinic, Kinston Community Health Center, Piedmont Health, Roanoke Chowan Community Health Center, Surrey Medical Ministries, and then a huge thank you as well to our grant advisory panel for their valuable input in these community engaged research projects. Lastly, please visit our website for a full listing of all of our grant core team members, our partners, advisory panel members, and a fact sheet is available there on the AIM 1 Internet survey data. We will also be adding more data and information sheets as we finish analyzing our results.